Our top story this morning, and overweight people should get free membership to swimming clubs. They be paid for by the health service.
Yes, the health watchdog NICE says GPs in England should be able to refer patients to clubs including Weight Watchers and Slimming World. Katie Fawcett has this report.
Tracy Foster is a shining example of what can be achieved on a weight management programme. When her GP referred her to this class 3 years ago, she tipped the scales at almost 30 stone. Now she weighs less than half that.
I didn't go out the house, suffered with bad depression, didn't have mirrors, didn't like looking at myself. It's just a different person. I've changed my life so much.
Today, NICE is officially endorsing classes like this as a good way to lose weight and keep it off, as long as they follow certain guidelines. For example, the programmes must be at least 12 weeks long. All staff must be fully trained and attend professional development sessions, and classes should focus not just on diet, but also on physical activity and behavioural change.
What we need to do is work with people who want to lose weight, help them to do it in a supportive way, and that's much more likely to be effective than simply being rude about people's weight.
According to today's guidelines, obese and overweight adults can make a huge difference to their health by losing just a little bit of weight, as long as they get the help they need to keep it off. Katie Fawcett, Good Morning Britain.
And Dr. Hilary is here. Good morning to you, Dr.
Good morning,
Hilary.
Susanna.
It's interesting. Yesterday we were talking about whether diets work. Today we're talking about whether prescribing these sorts of plans will work. As a GP, what do you think?
I'm very much in favour of this. We know that these organisations work. They get good results, whereas GPs don't. GPs have 7.5 minutes to talk to patients. These organisations, by using psychologists, trainers and dietitians, actually achieve good results. And if we can save people from becoming overweight or obese in the first place, we could potentially save the NHS millions of pounds, provided we give people the right motivation.
Yeah, and the kind of course that's being prescribed, is it long enough to get them kick-started?
Well, you wonder. I think it's easy to lose weight in the first 12 weeks for anybody. The key is to maintain that weight loss. So I wonder whether they shouldn't be doing a pilot study that encourages people to get free treatment in the second 12-week period rather than the first one, so they prove they have the motivation themselves to start. Having said that, many people, when they lose weight quickly in the first 12 weeks, will continue that weight loss because they've got the stimulation to do so. So I think it's important that we look at this scheme. I think potentially it could save a lot of money, cut out bariatric surgery costing £7,000 a time, and help millions of people long term to prevent heart disease and diabetes.